Hi everyone, I'm Dr. Swati, and today let's talk about PCOD and what are the radiological investigations we have to go through, what are the blood tests we have to go for so that we can diagnose PCOD as PCOD. So, what is the first symptom which any woman can get, and that might lead to thinking that okay, she might have PCOD? That would be infrequent, irregular periods. Anything which is causing irregular periods should be considered for PCOD. Yes, there are other reasons like fibroids, adenomyosis, or even hormonal imbalance, anything. But PCOD should be considered and it should be ruled out. Apart from that, hair growth, excessive hair growth. And I'm not talking about baby hair. I'm talking about beard like hair, very thick, coarse hair like men. After that, yes, acne. Without reason, your creams or the ointments you're using, facial creams you're using, they are same. But suddenly you have this um, acne from somewhere and you do not know the reason, then you should be considered for PCOD. Patient should be considered for PCOD, not you. So let's start with easy. Okay, so what will be the first investigation which a doctor will suggest? That will be ultrasound, and you will see cyst, multiple cyst. What is cyst actually? It's a fluid collection, bag with lot of fluid. So these cyst, you can see multiple cyst, more than 12, more than 8 mm, suggestive of PCOD. So here is this string of pearl appearance. If you can see, it looks like as if there's a necklace of pearls. So string of pearl appearance is suggestive of PCOD on ultrasound. But if you are a patient and you're watching this, it's all right. Just look for cyst in the report. More than 12 in the report. Multiple follicles in the report. And in suggestion, final interpretation by radiologist, just see for polycystic in the report. So PCOD stands for polycystic ovarian disease. So polycystic ovarian disease. Poly means multiple. Now multiple, as you can see, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So multiple cystic. Cystic means bag filled with fluid, sac filled with fluid. So these filled with fluid structures in ovary produces number of symptoms, and that's why it's called polycystic ovarian disease. Now, there are multiple tests which can be done for PCOD, especially hormonal profile for PCOD is done after ultrasound has been suggested, or maybe it is pending, reports are still pending, but we can always go for PCOD hormonal profile, and we start with these tests. This is like the compact diagnostic tool for PCOD. First, let's see what is LH and what is FSH. So LH, luteinizing hormone, will be very high in PCOD. In fact, in normal people, normal female, FSH is more than LH. But in PCOD female, it's reversed. LH is more than FSH. So FSH decreases and LH increases. First marker of PCOD. Now, because of facial hair, what will be increased? See, hair, coarse, thick hair in males, it is because of testosterone. So it is obvious that whenever a female is experiencing hirsutism, that means increased thickness in facial hair, beard like facial hair, mustache like uh, men, then definitely total and free testosterone will be increased, and that is elevated, like increased in PCOD. Again, DHEAS, it's also an androgen. Androgen means male hormone. Male hormone which is responsible for testosterone, and this is produced from adrenal glands, but it can be raised in PCOD. Okay, now prolactin. Prolactin, if there are high levels, please rule out other causes like prolactinoma or anything else, pregnancy maybe, because in PCOD, prolactin is usually found to be normal. Again, thyroid is also done to exclude thyroid issues. It has nothing to do with PCOD, but because if there is coexistence of thyroid problem, then yes, it will mimic or it can worsen PCOD symptoms. Like if because of thyroid, patient is having irregular periods. Now, because of PCOD, she's having irregular periods, so it's like a double sword. Again, estradiol, estrogen levels will be increased, and AMH. AMH is like an ovarian reserve, and it is increased in PCOD. I have seen a level of 12, 13, over 16 also in new PCOD cases, whereas normal AMH is around 3.5 to 4. But when PCOD happens, it goes high 16, 18, 20. Whatever the linearity of a machine is, depends. So AMH will be super high in PCOD, whereas in infertility, because of other causes, AMH decreases. But in PCOD, which is also causing infertility, AMH is increasing. Metabolic profile is often done in PCOD. Why? Because there is a certain level of insulin resistance in patients of PCOD. Now, this insulin resistance can cause diabetes-like symptoms. So, first is fasting blood glucose, fasting insulin for seeing whether there is resistance, whether insulin is produced nicely or not. Then HOMA IR. HOMA IR is also for resistance, insulin resistance. HbA1c is also for diabetes to see whether what is the 3-month average blood sugar level, because now because of insulin resistance in the body, blood sugar can increase. Again, lipid profile will be deranged because PCOD also manifests as weight gain, and you can see deranged cholesterol levels in patients of PCOD. Now, liver function test. Okay, because of weight gain, because of cholesterol imbalance, you can see that liver has been going through changes of fatty liver. So, sometimes it is very common in PCOD that patient is also having fatty liver. So, LFT is also done. And KFT is not affected by PCOD per se, but whenever you are trying to inculcate new medications to the patient, like it's baseline KFT should be done to see whether these medications we are giving to the patient, if they are affecting urea or creatinine anyway. Sometimes you have to start anti-diabetic medications. For example, metformin if blood sugar levels are high. Then also kidney function test should be done as to see the baseline level. For example, before the patient started metformin, it creat will be 0.8, and next time when she comes, you can again go for KFT to see whether creat is still normal or increased, and this helps the gynecologist or the treating physician to alter the medicine, to change the medicine, to modify the dose. So this is pretty much about the diagnosis of PCOD. Hope you enjoyed it.